Magandang hapon po sa ating lahat. Pagpapatuloy po natin ang ating pag-aaral sa 5 elements. Topic po natin ay ang 5 elements. So, yan po yung drawing ng 5 elements. Wood, fire, earth, metal, and water. So, si wood feeds fire. Mamaya po yung mga explanation natin sa susunod na slide. Si fire makes earth. Earth creates metal. Metal holds water. Water nurtures wood. Okay po. So, sa Sheng cycle po, ito yung creating cycle. So, ito po yung mga basis kung paano nagda-diagnose sa TCM. So, mula dun po sa elements, makikita natin na si wood, nag-create siya ng fire kasi pag sinunog mo nga, no? Then si fire, magiging earth kasi nagkakaroon ng as. Si earth, nagkakaroon ng metal, yung mga ore. Si metal, nagiging water. Si metal, nag-create ng water. Mamaya po natin maiintindihan pa paano. So, next slide. Yan. The Sheng cycle is a creation cycle. So, in-illustrate po nito kung paano mga elements nag-degenerate at nagkakaroon ng nurtures the next similar to relationship between mother and child. So, si wood creates fire. Yung explanation po doon, is yung simple lang. Di ba pag nagluluto tayo, kahoy ang ginagamit. Noong unang panahon ngayon kasi shilling na eh. So, yung kahoy, pag binarn mo, magkakaroon ng fire. Then, pagkatapos pong maubos yung kahoy, nagkakaroon po ng ash, yung abo. Siya yung po yung nag-creates ng earth. Then si earth creates metal. Kasi si earth po, siya yung nagpo-produce ng mga ore from which we create metal tools. Diba yung mga namimina, galing kay earth po yun. Yung mga namimina nating mga iba-ibang ores. Yun. Then si metal creates water. Water condenses on a metal surface. Then, si water creates wood. Water is vital to a tree ability to grow and provide wood. Siyempre, kung kailangan ni wood, siya yung pinandidilig natin para mag-grow, mabuhay ng maayos si wood. May mga example pa po dyan na mas naintindihan pa natin. Next slide po. So, from a clinical perspective, people develop digestive issues from irregular eating. So, nagre-represent po ang digestive system natin sa earth, si spleen and stomach. Yun. Excessive worry and overwork which leads to proliferation and of dampness. Yun, nagkikreate siya ng maraming damp. Yun. Pag sobra tayong irregular ang ating pagkain, sobra tayong nag-iisip, sobra tayong magtrabaho. So, si earth, na nandun si spleen and stomach, nakaka-produce po siya ng dampness. Na pag mayroon ng dampness, affects the metal elements. Ipapasa po niya kay metal. So, yun yung Sheng cycle, kung anong napoproduce ni earth, ipapasa niya kay metal. Si metal, andun yung lungs and large intestine. Within this case, you may see a combination of bloating gas and poor energy with development of metal. Ayun nga po yung silang symptoms, sinusitis or phlegm type asthma. So ipapasa po ni earth or ni spleen stomach na ang kanyang mga dampness kaya makakaramdam ng bloating. Bloating, yung parang puno yung tiyan. Tapos minsan yung tumutunog yung tiyan, yung may gas. Tapos mahina ang energy. So ngayon, pag naapektuhan po si metal, andun ang ating organ na lungs, magkakaroon ng sinusitis or nagkakaroon ng phlegm type asthma. Yung umuubo tapos may mga plemang lumalabas din na pwedeng malapot na plema na galing po yun from earth kay spleen stomach, ipapasa niya kay metal na nandun si lung and large intestine. So, ganun po yung nangyayari sa Sheng cycle. Pinapasa o generating cycle. Pag controlling cycle naman po, sa karaniwang layman's term, madali lang ito maintindihan eh. Pag nagsimula ka kay water, iko-control niya si fire. Siyempre kung may fire, di ba, ginagamit natin pang-buhos para mamatay si fire, ay tubig, yung mga ginagamit ng bombero, yun. Tapos si fire naman, kinokontrol niya si metal. Kasi halimbawa yung gumagawa ng itak, di ba, kailangan ma-shape siya, dadaan muna siya kay fire. Yun. Si metal naman, kokontrol niya si wood. Kasi si metal ang tagaputol ng puno, yung mga lagari, yung mga chenso, yun, control niya si wood. Si wood naman, ikokontrol niya si earth. Siya yung humaharang para hindi gubuho si earth. Okay po, may explanation pa po tayo sa next slide. Yung cycle po is one of control and describe how each element act to restrain another. So siya yung nagko-control. Wood controls earth. So wood is used to mold the earth into a dam. Yan, example po dyan. Pag gumagawa ng dam, kailangan mo ng wood para maharangan mo yung ihaharang mo siya. Mold the earth into a dam. Tapos si earth controls water. Si earth controls water. So si earth, di ba yung spleen stomach i-relate sa organ? Si water ay kidney and urinary bladder. A dam restrain the flow of water. So kung nakagawa na ng dam, syempre hindi na yung water ay maiipon na. Maiipon na siya. So water control fire. Water is used to extinguish a fire. Yun ang sinasabi natin na pag may apoy, syempre tubig ibuhos mo, mamatay agad si fire. Si fire control metal. Fire melts metal and allows it to be shaped. Yun yung sinasabi ko kanina po, pag gumagawa ng itak, yan, kailangan mong idarang sa apoy para magkaroon ng shape. So, siya yung nagko-control sa metal. Tapos si metal naman, kinokontrol niya yung wood. Metal saw is used to harvest trees for wood. Diba? Yun na nga po, yung lagari, yung chenso, yung itak, siya yung pumuputol kay wood, kaya siya yung nagko-control. So, yung mga explanation na po yun sa, explanation yan sa karaniwang ginagamit ng mga tao. Ngayon, nire-relate po natin sa organ. The controlling controlling or key cycle, tinatawag po natin itong grandfather and grandchild cycle. So, provides for check and balance system among all of the elements. Parang yun yung relasyon ng lolo at ng apo. Doon din po sinisimpleng tinitingnan yung cycle na yon. Within this cycle, Earths, for example, provide a control for water and is controlled by wood. Yun. Si Earth, kinokontrol yung water. Di ba, pag may harang na lupa, hindi makakadaan yung mga irigasyon sa sakahan. Kung tumitingin kayo sa mga irigasyon sa sakahan, ginagawa nila ng kanal para yung tubig, nakokontrol nila. Pag ayaw nila magpatubig, harangan ng lupa. Yun. So, and is controlled by wood. So, pwede rin haharangan ng wood. An example of this relationship within the body is in case of anxiety. Ang example po niyan pag sa organ, yan yung halimbawa yung sa fire. Pag masyadong si fire, yung heart, halimbawa masyadong mainit yung kalagayan ng heart, lagi kang walang tulog, kaya nagkakaroon ng fire o mataas yung yang ng puso, which are related to liver chi stagnation. Aapektuhan po niya si liver chi, nagkakaroon ng stagnation. So si liver chi ay ang wood. Where over time, you begin to see more kidney. At sa cycle po, aapektuhan po uli ni wood. So from parang pabalik siya controlling cycle, pabalik siya. Which are related to liver chi stagnation wood, where over time you begin to see more kidney, water-related sign as the water elements attempts to control the overactive fire. Yun, next po. tingnan natin yung example sa next slide. Ayan po So, yung normal na daloy, kaya lang pag nag-overacting na, si wood, control niya si fire. Ito si wood is a grandfather. And ang grandfather ni wood, ay ni earth ay si wood. Ang lolo. Ang apo ay si earth. Si earth naman siya ang lolo ni water. Ano po yung explanation Si water naman, siya ang lolo ni fire. So, ang apo ni water ay si fire. Ngayon, si fire naman siya ang lolo or grandfather ni metal. Si metal ay apo ni fire. Ganun po yung relasyon niyan. Tapos si metal naman siya ang grandfather ni wood. Okay, tingnan po natin ang next slide. So, yan ang overacting cycle. The overacting cycle of Sheng is imbalance within the controlling cycle, where the grandmother or grandmother element provide too much control over the grandchild and weakens the elements. Parang yung sa relasyon lang po yan ng maglola. Yung sobrang yung hinihigpitan yung apo. So, minsan nagre-rebel din na yung apo kasi sobrang higpit ni lola. Ganun po yun. Within nature, you may see water putting out fire. Pag sobrang higpit ni lola, talagang lumalaban si apo minsan. 'Di ba? Yung reality nga minsan may binalita na yung lola mismo pinatay ng apo. Sobrang hinihigpitan ni lola si apo. Ganun na yung ginawa ng apo, pero sobrang na po yun. May iba pang reason yun. Earth soaking up water and so on. So yung a clinical example, this relationship would be liver. Si liver po siya yung wood Pag nag-over-access spleen na nasa elements ng earth, ang makikita po ninyo sa case na to, you have an overactive wood element controlling earth. So, pag sobra yung active elements ni wood, makokontrolin niya si earth. Ang mangyayari kay earth, magkakaroon ng disruption in the digestive system. So, hindi magagampanan ni spleen stomach ang kanyang gawain kasi sobra siyang kinokontrol ni earth. Yun, nagkakaroon ka ng problema sa bituka. So, ganyan po yung ito naman, insulting o Wu cycle. Pabaliktad. Kasi ang normal sana, water control fire, fire control metal. Kaya lang to, insulting pabaliktad. Ang nagko-control ngayon kay fire ay si water. Ibig sabihin, kung ang organ mong heart ay masyadong mainit, i-consume niya si kidney, ang water ni kidney. Magkakaroon ka ng problema, mahirapan kang umihi kasi kukunti siya dahil kino-consume ni fire heart. Ang example yan yung laging mapula ang dulo ng dila, rule out mo, pati yung kidney niya pwede niyang apektuhan na maging kulang ng water yung kidney. Anong makikita nating silent symptom pag kulang ang water ng kidney? Tulad ng pasyente ko po, madilaw ang ihi at konti-konti kasi nako-consume na ng heat. Yun po yun, ang example. Next po, meron pa ba? Ayan. The insulting cycle or tinatawag nating Wu is also imbalance within the controlling cycle where the grandchild insult or return the controlling force generated by grandmother. Madali lang po itong intindihin is lang po nyo, i-relate sa karaniwang buhay. Na pag si lola masyadong inihigpitan si apo, yun ang reaction din kahit yung organ natin. Ganun po. Siyempre sa organ, yung function niya hindi niya magagampanan. So using example from nature, you can see fire burning up water and water washing away earth and so on. Yun. Pag sa clinically, you may see this in cases where people have long-term psychological problem. So kung i-relate po natin sa sa sitwasyon ng pangkalusugan, yung matagal nang may problema sa utak na tao, syempre yung situation po ng heart niya ay matindi na, yung fire, pwedeng mataas yung yang, Tapos which eventually affect the kidney. Dahil mataas yung yang, aapektuhan na si kidney, ito si water. Pwede niyang as seen in development of Morian water deficiency sign. Tulad po ng example natin, pag mainit yung isang organ, i-consume niya yung water ng katabing organ through Sheng cycle or co-cycle. So, ganun po yung relationship. Okay po, hanggang doon lang po. kung tayo po ay nalilito at nahihirapan, pwede po tayo
Napaka
magbahaginan.
napaka-complete na ng explanation nyo, Ma'am Mildred, no? So doon natin makikita na yung normal, yung first two, yung Sheng cycle saka yung co-cycle, no? Controlling saka yung generating. Yung abnormal, yung pathological, ito yung over controlling and insulting. Okay? So wala pong questions. Okay, mukhang walang questions. Maraming salamat, Ma'am Mildred. Tuloy-tuloy po tayo sa
Thank you
tongue
din po.
diagnosis. Let's welcome straight from Rizal, Ma'am Teresita Sumile.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Case 4 na po tayo ngayon at cardiac neurosis ang tatalakayan po natin ngayon. Okay? This 28-year-old beautician was known for her rash, loud, boisterous, and inconsiderate behavior. For 3 years, she had suffered from a heart neurosis and sleeping problems. Her panic attacks occurred mostly at night. Tachycardia and pains in the chest, connected with a strong feeling of fright, had her husband calling for an ambulance on many occasions. Conventional medical findings were negative. Because of her panic attacks, she was unhappy and dissatisfied with herself. In general, she was very aggressive, talked loudly, and appeared restless. The appearance of her panic attacks coincided with the complete disappearance of her sex drive. In her spare time, she sat in front of the television and ate sweets. While her menstrual cycle was regular, her periods were very heavy. The tongue was reddish and slightly swollen. The tongue coating appeared peeled and her pulse was rapid and thin. Okay? Analysis. Although the tongue body was swollen and of a reddish color, it was the large areas of peeled coating that suggested the onset of kidneyan weakness. The coating was especially peeled in the anterior and posterior thirds of the tongue, which is clearly seen in the tongue picture, okay, which is indicative of heart and kidney dysfunction. The history did not clearly show the reason for the deficiency. However, it was due to her strong fears about life that she would become homeless or that her husband would leave her. The panic attack started in a phase of her life when she lived alone for the first time. She felt very lost and lonely at this time and did not cope well with being on her own. The peeled tongue reflected quite clearly the location of the energetic disharmony, that is, the failure of fire and water to communicate harmoniously. The kidney yin was not nourishing the heart yin sufficiently. The ensuing fire from deficiency in the heart gave rise to the panic attacks, inner restlessness, and sleeping problems. The profuse menstrual bleeding contributed to blood deficiency, which also affected the heart. Okay? Now, the profuse menstrual bleeding also weakened the liver gland. her inability to fall asleep, and her unbalanced emotions may be due to insufficient anchoring of the ethereal soul by the liver blood. The swollen tongue indicates an accumulation of dampness in the interior. This may have been caused by the overconsumption of sweet, sticky foods. The slightly greasy coating in the center of the tongue indicates an accumulation of turbid dampness in the middle burner, which is related to her inappropriate diet. Now let's go to treatment. It was directed at restoring communication between the heart and kidneys, calming the spirit, and nourishing the blood. Simultaneously with the treatments, which lasted for months, the patient started to practice Qigong. Okay? Acupuncture treatments were given weekly for 8 weeks, followed by treatments at 2-week and then 4-week intervals. As a rule, not more than 4 acupuncture points were used in each treatment. Those sets of points were used quite frequently. The first set consisted of Heart 7, which is draining, CV15, neutral, and Kidney 4, tonification. The second set consisted of PC6, needled with neutral, then liver 8 and kidney 3 is for tonification. After 4 months of treatment, the patient felt well. She became noticeably quieter, more relaxed, and more pleasantly mannered. She has not had any panic attacks for 2 months. In addition, the tongue lost its peeled coating. Although the tongue body is still slightly swollen and of a reddish color, to stabilize the communication between the heart and kidneys, the prepared medicine Emperor of Heaven's special pill to tonify the heart was prescribed for 12 weeks. Okay? So as we can see in the tongue pictures before and after treatment, the patient has a great improvement as manifested in her tongue using only 6 acupoints such as Heart 7, CV15, Kidney 4, PC6, Liver 8, and Kidney 3, simultaneously with Qigong. Okay? Thanks so much for listening.
Thank you very much, Ma'am Teresita. O, di ba, kitang-kita talaga yung change. That's why you have to have pictures of your patient, yung tongue, i-archive nyo. No? If there are no questions, any questions? Tuloy-tuloy po tayo sa diagnosis by interrogation. And this time, let's call on Ma'am Vina Pascua, straight from Baguio. She will talk about blurred vision. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, ito nga day 3 na po tayo at eyes pa rin, blurred vision po. Excuse me. Blurred vision, ang tawag po nila ay, hindi ko po sure dito sa pronunciation, Mu Yuan in Chinese indicates not only blurring of vision and floaters, but also includes yung konting pagkahilo po. Although blurred vision is a relatively common complaint, pag tinatanong natin whether they suffer from it, most patients will either answer negatively or hindi po nila alam ang ibig nating sabihin. Thus, ang tanong po should be asked in a different way, such as, ganito po ang tanong, do you have any problems with your vision? O kaya, is your vision sometimes unclear? So, yun po yung mga tanong. First of all, it should be remembered that the eyes are under the control not only of the liver, but also of the gallbladder and kidneys. Especially po sa may edad na kagaya namin. A kidney deficiency is often at the root of eye problems and blurred vision. Among the deficiency types, ang karaniwan pong sanhi nito ng blurred vision ay liver blood or liver yin deficiency. Pag yung blurred vision po is associated with a dryness of the eyes, it suggests either liver yin deficiency o kaya liver and kidney yin deficiency. At ganyan na sabi, this is common in the elderly. Blurred vision also may be due to excess patterns such as gallbladder heat, liver yang rising, common feature po sa migraine, liver fire, and phlegm. Phlegm in particular is not often recognized as a possible cause of blurred vision. Marahil ito, ang sanhi rin po nito ay ng blurring of vision because it obstructs the clear orifices of the head, including the eyes. For this same reason po, phlegm may cause tinnitus o kaya tinnitus. So ito po yung patterns and manifestation. Sa blurred vision po, liver blood deficiency, may floaters at saka pagkahilo. Pag liver yin deficiency, dry eyes. Pag kidney yin deficiency naman, nahihilo o kaya ay may tinnitus. Gallbladder heat, eye pain, pula po ang mata. Pag liver yang rising naman, masakit po ang ulo. Pag liver fire, red, painful eyes. Phlegm naman, dizziness at saka muzziness. Next po tayo ay itchy eyes naman, excluding invasions of external wind. Itong pag kumakatip po ang mata are usually caused either by liver fire o kaya deficiency of liver blood, which give rise to liver wind. Itchy eyes in allergic rhinitis are a separate pathology which is not liver related but is related to external wind because the reaction caused by the invasion of allergies mimics that of invasion of external wind po. Next naman ay feeling of distension of the eyes. It is often associated with emotional problems affecting the liver, causing liver chi stagnation at saka liver fire. Next po ay streaming eyes. Streaming eyes may be due to heat of the full or empty type. In particular, it may be due to a full or empty heat of the lung or stomach. At ang mga ibang causes po nito ay, ng streaming eyes include external wind heat, liver fire, at saka liver blood deficiency. Streaming eyes may be due to heat of the full or empty type. In particular, it may be due to full or empty heat sa lungs po at saka sa stomach. At ang mga ibang causes po nito ay external wind heat, liver fire, at saka liver blood deficiency. Then ito po yung summary niya. Streaming eyes, lung heat, may cough. Lung empty heat naman, dry cough po. Stomach heat, epigastric pain. The thirst. Stomach empty heat, epigastric pains, thirst with desire to sip. Pag external wind heat, aversion to cold, o kaya fever po. Liver fire, pulang mata, mapait ang panlasa. Pag liver blood deficiency with some heat, ito na yung blurred vision, red eyes. Pag liver blood deficiency po, blurred vision. Kidney yang deficiency, sumasakit ang likod, abundant clear urine. Pag general chi deficiency, nakakaramdam ang patient ng tiredness, loose stools, at saka mahina po ang kanyang boses. Punta tayo sa dry eyes. The most common cause of dry eyes are severe liver blood deficiency o kaya liver yin deficiency. In the elderly, dry eyes are often due to liver and kidney yin deficiency. Sa ibang cases po, yung lung yin deficiency is also involved. Dry eyes with acute onset may be due to invasion of wind heat, in which case they would also kulay pula rin po. Then dry eyes naman, liver yin deficiencies, blurred vision, liver and kidney yin deficiency. dizziness and tinnitus, lung yin deficiency, dry cough, at saka yung last po, external wind heat, aversion to cold, at fever. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Maraming salamat, Ma'am Vina. Questions? Okay. We will now proceed to pulse diagnosis. And let's listen again to the voice of Ma'am Mildred. Good
Gandang hapon po
afternoon, Ma'am
ulit.
Mildred. Yeah.
Okay. So, pulse diagnosis, 64. So, ang irregular pulse po yung ating pag-uusapan ngayon. 3 non-traditional pulse qualities. Ito yung irregular. Pulse description. The irregular pulse stops at irregular intervals, but it is neither slow nor rapid. So the traditional pulse qualities of knotted and hasty also describe an irregular pulse, but only when it is slow or rapid. Respectively, in order to decide whether the pulse is irregular, it is necessary to feel it for a long time because the pulse may stop only after many beats. So yun, humihinto siya pagkatapos na maramdaman natin. Furthermore, it would be advisable not to diagnose an irregular pulse during the first consultation because the pulse may become irregular only for a definite time. This happens when the patient has had a shock or has suffered emotional stress. So pag alam natin na pag na-interrogate natin yung pasyente kung emotional stress, yun, pwede na nating simulan pakiramdaman kung ang kanyang beat ay irregular, kung meron siyang irregular pulse. Ang clinical significance nito, an irregular pulse always indicates a heart disharmony. Tandaan po natin, pag irregular pulse, heart disharmony po yun. Indicates. Which may be deficiency, such as heart chi or heart blood deficiency. Pwedeng kulang sa energy or chi or sa dugo. Or an excess such as heart blood stasis. Yan. As mentioned above, a pulse may be irregular only for a certain time when the patient has suffered a deep impact. Conversely, a person with an irregular pulse is easily frightened and is prone to suffer from shock. Matatakotin pag ganun pala ang pag-irregular pulse. Heart chi deficiency, heart blood deficiency, heart blood stasis, or shock. So related talaga siya sa heart. A person with an irregular pulse should not work too long hours. Bawal siyang mapagod ng magtrabaho ng matagal. Should not lift heavy things. Bawal din magbuhat ng mabigat. And should abstain from excessive sexual activity. Yun ang pinakamasaklap. Hindi siya pwedeng sobrang sexual activity. Lalo na sa mga lalaki. A person with an irregular pulse should not work too long hours, should not do heavy lifting, and should abstain from excessive sexual activity. So parang inulit lang pala yun. So combination, irregular floating. So indicates severe heart chi deficiency from overwork. So pag overwork, floating po ang mararamdaman natin. Pag irregular beat, nagsasabi to na mayroon siyang blood stasis. Pag irregular full, heart blood stasis din. Irregular empty, ay yung deep and full but stasis. Kasi yun nga, deep at saka full, excess condition. Pag irregular empty, indicates severe heart chi deficiency. Empty, kaya deficient. Yun po yung mga keyword natin lagi. Irregular choppy, indicates severe heart blood deficiency. So pag choppy, severe na ito. Deficiency din. Irregular slippery, siyempre pag may slippery, with phlegm yan. Heart chi deficiency with phlegm. So siya yan yung mga sign na yung parang nawawala sa sarili pag may phlegm na yung heart. Po. Differentiation of similar pulses. Intermittent. The intermittent pulse stop at regular intervals, whereas the irregular pulse stop at irregular intervals. Pag intermittent, regular. Pag irregular, irregular din yung paghinto. Knotted. The knotted pulse is a form of irregular pulse insofar as it is stopped at irregular intervals. So knotted, irregular ang kanyang paghinto. But it is slow, so mas mabagal. Unlike the knotted pulse, the irregular pulse has a normal rate. So yun yung pagkakaiba nila. Pag husky naman po, the husky pulse is a form of irregular pulse insofar as it is stopped at irregular intervals. But it is rapid, so mas mabilis. Unlike the husky pulse, the irregular pulse has a normal rate. Ano po ang clinical significance nito? Clinical significance in its position, this is not applicable because an abnormality in the speed or rate of the pulse will be the same in all position. So, yun po siya. Thank you po. Sana
Thank you very much,
tayo
Ma'am.
natandaan. Thank you po.
Walang tanong. Okay, let's now go to differential diagnosis. Let's welcome Ma'am Needs Yu. Good afternoon po, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Very clear po.
Thank you po. Okay. The topic for today in our TCM Foundations number 174 is heat invading the large intestine. Okay? So, generally speaking, this pattern happens more as acute condition. The full heat burns the body fluids in the large intestine and give rise to dryness. So the symptoms of dry stools, burning and swelling of the anus, thick yellow dry coating, and a rapid pulse. As we all know, stomach is closely related to the large intestine through the bright yang channel. Therefore, heat normally coexists in both organs and it leads to dry mouth and dry tongue. Finally, the large intestine is located in the lower burner and the heat condenses the body fluids there so that there is less urine and the color is rather dark. Okay? So, summary, heat invading the large intestine, etiology, excessive consumption of heating and or drying foods. Externally contracted febrile disease, manifesting as Yang-Ming pattern, also known as disease in the Qi aspect. Possible stomach heat underlying. Okay? Sign and symptoms: constipation with dry stools, abdominal pain with dislike of pressure, a burning sensation in the mouth, dry tongue, burning and swelling of the anus, scanty dark urine. Okay? Pulse, full and rapid. Tongue is thick yellow dry coat. Okay? Treatment principle: clear heat and free the stool. Okay. Acupuncture treatment, we're going to use stomach 25, regulates the intestines. Lung 11, clears heat. Stomach 44, harmonizes the intestines, clears heat. Kidney 6, supplements yin, promotes the fluids. Bladder 25, moves large intestine qi. Stomach 37, regulates intestines, clears heat. Large intestine 2 or the Erjan clears heat. Okay? So, technique, needle with drainage or reducing method. Thank you very much. I hope you learned. Thank you po.
Thank you very much, Ma'am Needs.
Thank you, Doc.
Okay, wala po yatang questions. Now we will now proceed to acupuncture patterns and practice. Tatawagan natin ulit si Ma'am Vina Pasqua of Baguio na mukhang nakaka-relate yata sa ating topic. So,
Opo, Doc. Excuse me. So, acupuncture patterns. Good afternoon po, Dr. ulit at saka classmates. Acupuncture patterns practice wind injury po, common cold. Part 2. Key points of analysis. Wind cold and wind heat po. Cold and heat ay magkaiba po ang nature and kailangan po magkaiba din ang treatment. So, importante po na i-determine natin pag yung sakit is one of a wind cold o kaya wind heat. In general, injury by wind cold is characterized by stronger cold aversion than fever. Masakit ang ulo, masakit ang mga katawan, and nasal mucosal congestion with clear discharge. Injury by wind heat is characterized by fever na mas malakas po than cold aversion. Masakit ang ulo, so para nauuhaw siya. May nasal mucosal congestion with thick yellow discharge at saka sore or swollen throat. Among these symptoms, whether the throat is sore and swollen o kaya hindi, is often the key for para malaman natin yung kaibahan. Wind heat from wind cold. So sometimes, in the initial stage, an illness may be one of injury by wind cold, but a few days later, sore throat nagde-develop and the nasal discharge changes from yung clear, magiging yellow at saka makapal. This reflects gelling of the cold evil and its transformation into heat. Sa stage na ito, yung treatment is that for wind heat. Accompanying pathogenic evils. In attacking the body, yung wind po is frequently accompanied by one or more of the other exogenous pathogenic evils. Itong dampness often accompanies wind during the rainy season of late spring and early summer. Ito yung tinatawag nilang plum rain season. Wind dampness injury is characterized by low-grade fever po, sakit ang ulo, na parang ini-squeeze siya. Yung bone at saka yung joint pains, yung sa dibdib din, may tightness, and a bland or sweet taste in the mouth. Heat accompanies wind mostly during summer. Wind heat injury is characterized by may lagnat na para with sweating, agitation, thirst, decrease and dark urine, and a yellow and grassy tongue coating. Dryness accompanies wind mostly during autumn. Dryness wind injury is characterized by fever, headache, dry nose and throat, cough with no or slight sputum, nauuhaw at saka pula po ang dila. Indigestion from dietary excesses occurs mostly following festivals or celebrations. Indigestion with wind injury is characterized by feverish body, chest, and epigastric distension, anorexia, and nausea. Diarrhea and grassy tongue coating. So, in clinical practice, importante po na ma-determine natin kung anong pathogenic evils ang kasama ng wind. Building on the foundation of releasing the exterior and unblocking the lung, the physician applies treatment to dissipate dampness. Expel po yung heat, moisten dryness, at saka tanggalin po yung stagnation. At ito lang, only by doing so can the physician obtain excellent response. Ito naman po strength and deficiency. Wind injury is mostly an illness of strength of pathogenic evils, not only invariably so. In differential diagnosis, yung physician po must first determine whether yung illness ba is due to strength in the exterior or underlying deficiency sa exterior. In general, fever with sweating and wind aversion are symptoms of deficiency sa exterior. Pag yung fever naman na hindi pinagpapawisan, cold aversion and body aches are symptoms of strength in the exterior. In an illness naman of deficiency in the exterior, yung appropriate treatment is to disperse wind, to release the exterior, but not to overuse acrid release. In an illness of strength in the exterior, yung appropriate treatment po is to induce sweating para ma-release po sa the exterior, as fever subsides upon sweating. Sa deficient body, pag inattack po by an exogenous evil, meron pong maaring maulit-ulit po yung episode of illness. Ang proper approach po to treatment must be principally to support po the genuine in order to dispel the evils. Thus, in addition to applying a method of exterior release in accordance with the specific exogenous evil, yung physician po must always attend to the support of genuine chi. Ang acupuncture treatment po for wind cold injury, maaring mamili po tayo. The acupoints in the lung meridian of Han Taiyan, the large intestine meridian of Han Yangming, and the bladder meridian of Put Taiyang, such as lung 7, bladder 12, GB20, Li4. Ang gagamitin pong needles ay filiform with the reducing method. Sa mga patients naman, pag mahina ang kanilang constitution, gamitan ng mild reinforcing and reducing method. Moxibustion may be applied na idagdag po. For wind heat injury, mamili rin po sa mga points na ito sa small intestine meridian of Han Taiyang, the large intestine meridian of Han Yangming, and the Sanjiao meridian of Han Xiaoyang. Gaya ng GB4, Li11, Li4, Lang 10, at saka Sanjiao 5. Ang gagamitin na needle filiform by shallow insertion lang and the reducing method. So dito po sa case study, yung patient po ay 29-year-old male. Nagkasakit siya with abrupt onset the day before na nagkonsulta pa siya. Nagkonsulta po siya. Meron siyang cold aversion, meron siyang fever, pero hindi siya pinagpapawisan. Masakit ang ulo, masakit ang kasukasuhan, may ubo, at makati po ang lalamunan with white sputum. Tuyo po rin po ang kanyang bunganga, pero ayaw niya pong uminom. Ang kanyang coating ay white at saka smooth, at ang pulso po niya ay floating, tight, and rapid. Ang temperature po niya was 37.9. Ang pulse rate niya ay 92 beats per minute. Yung white blood cell counts was 72 with 78% neutrophils and 22% lymphocytes. X-ray and fluoroscopic studies of the chest ay normal naman. Diagnosis po, wind cold joined by dampness, all lodged in the exterior. Defensive label po, and causing, ito po yung cause, yung impaired flow of lung qi. Ang therapeutic principle po, liquid warm release sa exterior. Yan lang po. Thank you, doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Okay, after acupuncture patterns, punta naman tayo sa signs and symptoms. We will go back to Cainta Rizal. Let's listen again to Ma'am Teresita Sumile. Good afternoon ulit, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon din po sa mga kaklase ko. Signs and symptoms, we have now feeling of obstruction of the throat. In full condition, we have liver qi stagnation. Signs and symptoms po are feeling of a lump in the throat that comes and goes according to the emotional state, hypochondrial or epigastric distension, irritability, moodiness, premenstrual tension, and wiry pulse. Acupuncture used are liver 3, TB 6, pericardium 6, and Li 4. Lung and stomach qi deficiency. Signs and symptoms are feeling of a lump in the throat that comes and goes according to the emotional state, sadness, worry, grief, depression, a slight feeling of tightness, oppression or distension of the chest, slight breathlessness, difficulty in swallowing, sighing, irritability, epigastric pain and distension, belching, nausea, vomiting, hiccup, tongue slightly red on the sides and the chest areas, pulse slightly wiry on the right. Acupuncture points are lung 7, P6, LI4, and Shen. Next is qi stagnation and phlegm. Signs and symptoms are a feeling of a lump in the throat, phlegm in the throat that needs frequent clearing, expectoration of scanty sputum, a feeling of oppression of the chest, irritability, swollen tongue with sticky coating, and the pulse is slippery, wiry. Acupuncture use are LI4, lung 7, P6, stomach 40, REN 5, REN 7, REN 9, REN 5, bladder 22. Now we have also other patterns like lung iron deficiency. Signs and symptoms are a feeling of lump in the throat, dry throat at night, tickly throat, cough that is dry with scanty sticky sputum, weak and or hoarse voice, tiredness, dislike of speaking, thin body or thin chest, night sweating, normal color tongue without coating, or with rootless coating in the front part, and the pulse is floating widely. Next is kidney deficiency. Signs and symptoms are a slight feeling of a lump in the throat, dry throat at night, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, lower back ache, ache in bones, nocturnal emissions, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, normal colored tongue without coating, and has floating empty thoughts. Clinical note. A feeling of obstruction in the throat strongly indicates emotional stress with qi stagnation. Note that this is not always related to the liver and may be related also to lungs or heart. Bansha Hopo Tang is for stagnation of lung qi in the throat from worry or grief. Pasensya na po sa mga Chinese words. Thank you so much for listening.
Maraming salamat, Ma'am Teresita. So,
Thank you po.
from signs and symptoms, punta na tayo sa last but not the least topic. The topic on asthma. Let's welcome again Ma'am Mildred, the ever-reliable Ma'am Mildred.
Magandang hapon po muli. So, ang interesting topic natin, asthma, early onset allergic asthma and Xiao Shuan. Tama kaya yung pronunciation natin? Shuan?
So,
Okay.
tama na lang siguro.
So, Win. As the main pathogenic factor in allergic asthma. So, it is interesting that Dr. Ye states that the pathogenic factor in wheezing, Xiao, ang wheezing pala sa Chinese ay Xiao, is sometimes active and sometimes distant. In my view, the intermittent nature of the pathogenic factor confirms that wind rather than phlegm. So, sabi ni doktor, pag allergic asthma, mas tinitingnan niya na wind ang dahilan nun, hindi ang phlegm. Is the main pathogenic factor in allergic asthma. As it is in the nature of wind to come and go and change rapidly. So, yun yung basis niya. Kasi ang wind, biglang andyan, biglang wala. Yung allergic, biglang andyan na allergic ka, biglang nawawala din. So, whereas phlegm would not have this intermittent nature. So, pag phlegm, hindi daw ganon. So, the contraction of the bronchial muscle by itself may be the sole cause of airway narrowing. So, siyempre pag lumiit, na yung airway, yun yung nahirapan ng huminga at nag-wishing. Such a contraction may be attributed to wind in Chinese medicine as it manifests with the symptoms of wind. That is, wind contracts, it may come and go and changes rapidly. This explains why an asthmatic breath well in between attack. So yun yung tingin ni Dr. Ye na ang dahilan ng allergic asthma ay ang wind than phlegm. So, it is in the very nature of asthma that it occurs in paroxysm. That is, it comes and go. Indeed, some chest specialists say it's not much the symptoms themselves, tightness of the chest and wheezing, that enable us to diagnose asthma. These symptoms occur in the chest disease as the circumstances under which they occur. In asthma, it is characteristic that they occur in paroxysm. This is due to the nature of wind that comes and goes. So yun yung explanation. Another characteristic of allergic asthma that points to wind as a cause of disease is the fact that although the asthmatic does not become breathless during exercise, much more importantly, he or she become even more breathless after exercise. So pagkatapos niya mag-exercise, mas nawawala ng hininga. Has ended the progressive paroxysm of tightness, coughing, and wheezing following exercise reaches a peak within a few minutes and may last for half an hour. Virtually no other than type of chest disease is associated with symptoms that get worse immediately after exercise. Okay po. Of course, in chronic asthma, other factors account for the narrowing of the airways. Yung lumiliit yung daanan ng hangin. So, that is a swelling of lining of the airways. Nagkakaroon ng pamamaga. The presence of mucus. The more chronic the asthma, the more these two factors play role in the narrowing of the airways. So, ganun, pag yung matatagal na yung asthma. The mucus that forms in the airways in allergic asthma, however, is a consequence of the inflammatory reaction. So, nagpo-produce ng mucus dahil nga may pamamaga, which itself is a consequence of the allergic reaction. Therefore, we can say that mucus is more the result than a cause of allergic asthma. It is also interesting to note that there is a difference between the type of mucus in chronic bronchitis and that in asthma. In chronic bronchitis, there is reduction of serous acini. In asthma, the normal serous mucus acina ratio is intact. The plaque in asthma have a non-mucus component. What is the pathogenic factor in allergic asthma then? Basically, it is wind, not exterior wind invading the lungs, defensive chi portion, nor interior wind, which pertain to the liver, but a kind of chronic exterior wind with lodged in the bronchi and periodically leading to bronchospasm. So from exterior wind, siguro pag masyado siyang na-expose sa mahanging lugar, yun, nagkakaroon ng allergic reaction yung lungs. The attacks is elicited by exposure to allergens, viruses, or cold weather, or by emotional stress. So pag na may mga allergens, yun, susumpong. The nature of this wind is a pathogenic factor in asthma will be expanded on shortly. Clinical note, wind in the bronchi is the main pathogenic factor in asthma as it contract causing bronchospasm. So, dahil sa wind. Comes and goes, accounting for the paroxysmal nature of asthma. Is non-substantial, does not show up on X-ray. So, hindi nakikita sa X-ray. Change rapidly, accounting for normality in between attack. So yun yung basis bakit sinasabing wind ang dahilan ng asthma. It is also interesting that X-ray have no diagnostic values in asthma. This seems to confirm that wind and not phlegm is the main pathogenic factor in asthma. Wind is non-substantial pathogenic factor and as such, it's naturally would not show on X-ray. Siyempre, hindi makikita yung wind sa X-ray. Whereas phlegm, a substantial pathogenic factor, would. Although there is excessive mucus production in the airways in allergic asthma as a result of inflammatory process. This is more the result rather than the cause of pathology. Of course, in a person with early onset asthma, after many years, in adulthood, the pathology becomes more complicated and other factors, including phlegm, may play a role. This happens or under the influence of several etiological factors such as overwork, emotional stress, excessive sexual activity, and irregular diet. Yun ang mga nagiging cause ng hika. All factors will not present in childhood. The more chronic the asthma, the more phlegm there is. So kung matagal na ang asthma, mas maraming phlegm ang napoproduce. Thank you po.
Thank you very much, Ma'am Mildred. Do we have any questions? Okay, happy Ramadan sa ating mga kapatid na Muslim, si Ma'am Rian at saka si Ma'am Vads. Ngayon po
Thank you po, Doc.
Oo. Yeah, so para ma-cleanse yung ating soul. So, any questions po? Wala po tayong Zoom mamaya dahil Thursday. Nag-Zoom na tayo kagabi kasi merong meeting lang mamaya. And then we will see each other. Wala din bukas. So we will see each other again on Monday. Okay? Monday po ng hapon, 5 o'clock. And thank you very much for all to all the participants, especially the presenters. Maraming salamat po sa lahat. Have a great weekend. Good
Thank you
evening.
so
Thank you, Doc.
Thank you po. Enjoy. Ingat po.